We talked about some of the motor skills that will change as the disease progresses, but there's also non-motor symptoms that you will start to notice in your loved one. Something that happens is they're going to have a loss of sense of smell. What can this mean? It means that they might not know if their hygiene isn't up to par. You're going to have to really help them with washing in the morning and washing in the evening. Also, if you don't have a sense of smell, what is it going to be hard to do? It's going to be hard to eat. If nothing smells good, why would you want to eat it? So in this way, you're going to have to add some more spices just to make the food taste a little bit better for your loved one. Mood disorders. This is something that can be very hard when you're close to your loved one. Somebody that's always been very happy may be very sad and depressed. They may be crying. They may be thoughts of not wanting to be on the earth anymore. They may be angry. And this is something that we'll discuss a little bit more when we talk about behaviors, but this is very common for somebody who has Parkinson's disease. This isn't you, this isn't your loved one, it's the disease. Sleep disturbances. As the body changes and they progress through Parkinson's, it's going to be harder for them to sleep throughout the night. They might have cat naps during the day, and there might be periods during the night when they're completely awake. So you want to make sure that they have 24/7 supervision when they reach this stage. Just in case they want to get out of bed or they want to do something, you need to have a caregiver there to help them during this part of the night when they weren't typically awake. Constipation and bladder problems. As the body changes, there'll be difficulties with constipation and especially with incontinence. You can use pads and different products to help them maintain that quality of life, and you definitely want to reach out to your doctor to discuss what you can do for constipation. One of the biggest things, which is not going to be a medical intervention, is going to be being active and exercising. That's wonderful for anyone with Parkinson's, and it's also going to assist with constipation. Visual and dental problems. We want our loved ones to be independent. A lot of times we will set up their activities of daily living, so we may put out the toothbrush and the toothpaste and give them some privacy so that they can still do some things themselves. It's important for you to still be there and to still provide verbal cueing, which is just short verbal directions, so that these tasks are still be done properly. When you go into the dentist, if you haven't been assisting, you might be shocked to find out there's multiple cavities or buildup when they may have never had issues before. Fatigue and loss of energy. Imagine all of the changes that your loved one's body is going through. We talked about motor symptoms, we talked about non-motor symptoms, about sleep disturbances. At some point during the disease, it's very common, maybe 70% of people with Parkinson's will develop dementia. So then you're also having difficulty with memory and difficulty in processing. It takes them a lot longer to complete tasks, and this is extremely fatiguing. So even though you want your loved one to be engaged and to be busy throughout the day, you need to have pockets and times for them to rest so they don't get overtired and overstimulated. Depression. Again, think about all of the changes. Think about all of a sudden not being able to do things that you could easily do yourself. Having to count on maybe a sibling, a daughter, a son, your wife to take care of you, to help you go to the bathroom, to help you shower. This is a major loss of independence, and it can be embarrassing for some people. And often depression will come along with this. And this is something you're certainly going to want to reach out and talk to your doctor about. Fear and anxiety. This stems from the depression. All of a sudden they're seeing these changes and they're realizing that they can't do these things anymore. They're not capable. So they may become very dependent on their caregiver. If the caregiver is away out of the room doing something, they may feel fear, they may feel anxiety. What do I do if I need something? And lastly, skin problems. We talked about incontinence. You need to assist with helping keeping your loved one dry so that you don't have skin breakdown and that they won't develop a urinary tract infection. That's a lot of non-motor symptom changes.